Start.
Hello,
Hello.
this is Dr. Gabra, the doctor in the medical clinic. Are you the son of Mr. Andrew Garfield, 68-year-old?
Yes, doctor, I am. I am waiting to talk with you about my father's condition, doctor.
How can I address you, please?
My name is John, doctor.
Okay, Mr. John, we are here today to discuss your father condition. Is that okay?
Yes, doctor. I just want to know what is happening with my father.
Can I know first, before we proceed, how much you know about your father condition?
Doctor, my father had a condition in his lung called COPD, and for that he sometimes get worse, and he needs hospital admission. And this time he also developed shortness of breath, so we brought him to the hospital.
So, Mr. John, after your father admit here, he require antibiotic. But unfortunately, something unusual happened because of miscommunication. So
What
your
do you mean,
father,
doctor? Can you make it some clear? I couldn't get you.
after your father admitted here, he was given by mistake amoxicillin for the treatment of his infection, bug infection. But don't worry, Mr. John, we got that early, and first he start symptom, we treated immediately, and he is fine now.
What do you mean by doctor? Does it mean that you gave him a penicillin?
Mr. John, I'm so sorry, but it is a type of penicillin.
Why did you do that, doctor? He admitted to this hospital repeatedly, and this is about a fifth time or sixth time. And you gave him penicillin. He is allergic to
Mr.
penicillin. It's known to everyone. And even I told the
Mr.
emergency department that he is allergic to penicillin. I myself told the emergency doctor at that time.
Mr. John, I apologize on behalf of all team. But this mistake, it is totally unintentional, and it's unusual, and it happened very rare.
No, doctor, it is not very
But
rare. This happened also previously, and at that time he was told that he is allergic to penicillin, and at that time he developed so much rash on his body. He developed so much shortness of breath. He developed so much swelling, and this time all this happened to him again.
I'm so sorry. This the very bad luck. It happened for you twice, but really, it's very rare to be happen. We follow very strict rule and regulation and policy, and to avoid this to happen.
How is
But
condition now, doctor?
don't worry, Mr. John. First, we discover this allergy. We try the team treated immediately, and we control all symptoms, and he is okay now.
Okay, will it affect his future management, or will he become ill again due to this injection?
No, Mr. John, we treat him, and he is now under observation. If he develop any further allergy, he will be on good hand, and he will be treated immediately.
Okay, cannot you be so much more careful? Why? Who did this, doctor? Why didn't
Sure.
tell you that he is allergic to penicillin?
This was happened by mistake, but unintentionally. For that, we report incident report for the higher management, for the regulation. So this case will be raised for investigation, and there will be action in order this mistake not happen again. And we will highlight the allergy in your father record, and we'll be very careful about that.
Okay,
and you ask me who did that. Mr. John, we work here under team, so every one of our team responsible about this mistake. This mistake happened, but we treat all the complication. And I promise you this will not happen again, and all the effort done to reduce such mistake in the future. Any further concern, Mr. John?
No, doctor, I just want to know that if this causes any delayed reaction, if this suppose that the medication is within his body, so if he get ill after going back to the home.
Not likely to happen again, but anyway, he is under observation and he will be in the hospital until we sure he is 100% okay. That time we can send him home. I'll provide you with leaflet and website and with the number of the hospital, so you can call anytime. Any further concern, Mr. John?
No, doctor, you have explained everything well. Just don't do this again. I just request that.
Sure, Mr. John already.
Time up.
Thank you.
Okay, this your performance was so excellent. I don't have anything to add.
Because we did a similar scenario a few days ago.
Oh, I cannot remember. Okay, I'm going for the next page. Okay, let's start.
Hello.
Hello.
This is Dr. Gabra, doctor in the medical clinic. Are you Mr. Andrew Garfield, 68-year-old?
Yes, doctor, I am.
Okay, nice to meet you, Mr. Garfield.
Nice
We
to
are
meet
here
you.
today to discuss your condition and what we can do further. Is that okay with you?
Okay, doctor.
So before we proceed, I understand that you have a condition of COPD, the
Yes,
chronic
doctor. Yes, doctor, I have that.
inflammation of the lung. Can I know how you feeling now?
I feel a little shortness of breath, doctor. I think that this device isn't working so much for me.
I'm so sorry. I will try our best to help you out. So, how much you know about your condition?
Doctor, I heard that there is some scarring in my lung and that cannot be cured. Rather, I will be on medication, and if I get worse, then I'll need hospital admission.
So, Mr. Garfield, as you said rightly, you have a chronic condition of the chronic inflammation and scarring of your lung. This causing long-term disease and long-term narrowing of your windpipe with frequent secretion and cough. And this condition has a tendency to come and go with exacerbation. And you came today to the hospital with exacerbation, and the team managing you, they expect this exacerbation may be severe one, and maybe your condition will get worse. Are you with me, Mr.
Okay,
Andro?
doctor, I can get you, and I also can understand that it is getting worse. So, what can you do for me now?
So, Mr. Andro, I appreciate your concern. The team managing you seen that one of the option of treatment in the future, in case your condition deteriorating more and you require supporting by artificial machine. A tube will be introducing in your windpipe after making you calm to support you with artificial ventilation by artificial machine. Are you aware about this
I
type of management?
heard a little, doctor, about the machine that can cause the artificial breathing. And will I get fine with that treatment?
I appreciate your concern, Mr. Andrew, but this is the point I want to discuss it with you. Now, many person will supported by this artificial machine improve and we remove later. But in your condition that you have a very long period of the disease, and your disease itself has a tendency that if you put on the in this machine, it is a little or more difficult to be removed later because of the established disease in your lung.
So that I will not get benefit from this machine.
It will support your windpipe, it will support your ventilation artificially, but it is very difficult to be wean out later from the machine. So there is a chance that you will be in the machine for longer period, and maybe you will stay more in the intensive care, and sometime you will be for very long period. Either you will go to the ward with this artificial machine, or sometime with the home machine. Do you get me, Mr.
Yes, doctor.
Andrew?
Is there any thing that I can happen in any injury or any bad effects due to the machine?
Sure, I appreciate your concern, Mr. Andrew, but every treatment has its own side effects. This machine giving you uh, forcing good air to your
Permanent remaining.
windpipe. This sometime causing injury to your windpipe, sometime causing blood in the windpipe. Sometimes there is hyperinflation of your lung. Sometimes causing life-threatening condition like decrease in your blood pressure, hyperinflation in the lung. So you should be aware about it.
So what do you suggest, doctor? I should go for that?
Mr. Andrew, it is totally your right to choose either one. You can consent for this machine, but in the same time, you should know that there is a good chance that you will be for a long time with this machine. So if you agree to be in the machine, so it's fine.
Okay, you have done pretty excellent. And
But I don't finish the task.
No, you couldn't finish because you talked much. And I think you could take little time because patient know about his condition that he has COPD, and I have seen that time. You have taken 40 seconds to explain the condition again. Patient know that he has COPD and he need hospital admission sometimes. So you can go for the next question that okay, if this time you also came to the hospital admission and our treating team found that your test results are getting worse. That is, it is going to get mass worse and worse. Do you know that what treatment option can we choose if this condition get worse at this stage? With only a few seconds, you could get to the point. Okay.
Okay.
Do you get me? When I said that
Yes.
yes, when I said that yes, I have a condition is carrying in my lung, and I needed hospital admission. I needed to take drugs regularly. I needed hospital admission. I need good dose. This time I also got shortness of breath. I needed hospital admission. And at that time, you could say that okay, this time you know well about your condition. Actually, at this time we are following up you, or we are checking you regularly, and we find that your condition is getting worse. So do you have any idea what we do if this condition gets worse? You could get to the point. You don't have to explain what patient knows already. Okay.
Mm.
And at that time, I could say, no, I don't have any idea. Then that you could say, okay, at this point, if this condition get worse, we may need some machine support, machine supported breathing. Have you ever heard of it? No. Okay. With this, we introduce a pipe or through your windpipe, and it gives good air to the lung by by an artificial machine. Okay, and in this time, after your lungs condition improves, we will remove the machine again. You don't have to give so much information because we don't have so much time for that. At the time, I will say, okay, will I feel pain? Will I feel better? If I say, will I feel pain? Okay, you will say that no, we will give you some injections, so you will not feel any pain, and you will remain unconscious during this machine. supported breathing. After that, I also said that, okay, will I be okay with this medication or with this supported? There is chance that you will get better, and also there is chance that your condition get much worse with this machine, and even we may not able to remove the machine again. You may totally dependent on the machine, so there is chance that you will never be out of machine again. And I am sorry to say that it can also you can also end life in there, because sometimes patient becomes so much machine dependent that winning is not possible, and they die. Okay.
And should I encourage him for the machine?
No, you shouldn't encourage, but you should say that it is likely to improve your condition, but there is also chance that you will not be able to get out of the machine.
Because he asked me directly if
He
what
will ask
your
he will
advice.
ask directly in the exam also. And also I asked that what is the side effect, or what is the adverse effect of this. You said that every thing has side effects. You don't need to say so much. Just say, okay, I can understand your concern. Actually, this has few side effects, like during introducing, it can cause some scarring, some injury to the windpipe, can cause some um, uh, what is called can cause some injury to the windpipe, can cause some leakage in the windpipe, can cause some bug infection in the tract. Okay. And he also said there is some hyperinflation. That is also a medical term. You shouldn't mention that. Patient doesn't know what is hyperinflation. They could say just simple term. It can cause injury. It can cause that is called uh, some leakage in the air pipe and some bug infection. And also after removing the machine, you can get some pain. You can get some more shortness of breath due to the scanning in the windpipe. Okay. During and after, so your patient will get idea that why what is this good effect and bad effects. And bad effects are that machine may develop so much machine dependent that they never be able to get rid of there may never be able to do weaning from the machine, and patients sometimes may die in the ventilation also, during the ventilation. So it is not 100% curative. You should emphasize on that it is not 100% curative. It gives you some support, and with the support you may get well. And I am afraid to tell that sometimes it is not so much predicted, so it can you can get mass worse. We are not totally sure that what will happen in your case. Just give a short sentence, but all the information, and try to cut some words, like every treatment have so much side effects. We don't have time for that, and what patient know, don't try to repeat it again. Just go to the point as soon as early possible. Okay. Otherwise, everything was fine. Just you added some points, so you couldn't answer some of my question. And when I asked you that what do you suggest, you will say that, okay, I am not the person to suggest you anything. I can give you all the information you need to consider yourself, and it is your decision. We will always respect your decision. And if you need any other information, then you can always ask us. We can always give you the information. After knowing all the information, you can give the decision. Okay. Don't ever say my suggestion, my advice, never like that. Just you will say that I will give you all the information. If you need more information, I can give you that, and after that you will consider it, and then you will take a decision on your own. Okay.
Okay.
Okay. So time management is very important. Keep in mind again.
Yeah, it is 6 minutes.
Yes.